Good morning, I'm Angela Joy Amdeleon, BSN 3G from Nueva Ecija University of Science and Technology. And today I will demonstrate the nasogastric tube feeding or NGT feeding. For the assessment, first we need to check the doctor's order, and then assess the client's level of consciousness and level of knowledge and understanding. Then assess the availability and functionality of the needed materials and any clinical signs of malnutrition or dehydration. Then we need to assess for allergy to any food in the feeding. If the client is lactose intolerant, check the tube feeding formula and notify the primary care provider if any incompatibilities exist. For the planning, before commencing a tube feeding, we need to determine the type, amount, and frequency of feeding and tolerance of previous feeding. For the equipment, we need to prepare the correct type and amount of feeding solution. 60 ml catheter tip syringe, mimesis basin, clean gloves, pH test strip or meter, a large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube or refilled bottle with a drip chamber, and a flow regulator clamp. Measuring container from which to pour the feeding if using oven system. Water, 60 ml unless otherwise specified at room temperature. Feeding pump as required. For the implementation, first, prior to performing the feeding, we need to introduce ourselves and verify the client's identity using agency protocol, and then explain to the client what we are going to do and why it is necessary and how he or she can participate. And then inform the client that the feeding should not cause any discomfort but may cause a feeling of fullness. And then perform hand hygiene and observe appropriate infection control procedure. Next, we need to provide privacy for this procedure if the client desires it, because tube feeding are embarrassing to some people. And then, assess the tube placement. Apply clean gloves. Then attach the syringe to the open end of the tube and aspirate for check the pH. Allow 1 hour to elapse before testing the pH if the client has received a medication. And use a pH meter rather than pH paper if the client is receiving a continuous feeding. And follow agency policy if the pH is equal to or greater than 6. For assessing residual feeding contents, if the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Before administering the feeding, we need to check the expiration date of the feeding and warm the feeding to room temperature, because an excessively cold feeding may cause abdominal cramps. Next is clamp the feeding tube before all the water is instilled, because clamping prevents air from entering the tube. And then we need to ensure the client's comfort and safety by secure the tubing to the client's gown, because this minimizes pulling of the tube, thus preventing discomfort and dislodgement. Next, we need to ask the client to remain sitting upright in Fowler's position or in any slightly elevated right lateral position for at least 30 minutes, because these positions facilitate digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspiration of feeding into the lungs. For the evaluation, evaluate the client's response to the procedure and document the procedure and other important data on the client's chart.